Hi there, welcome back to my channel. If you are new here, my name is Anim Awe. I'm a licensed mental health therapist. I'm also a clinical health educator, also a scrum master, and today we're talking about taking a mental health day off from work. Now, this seems to be a topic that's pretty popular, and so I want to help first give you some strategies to take that mental health day and also normalize this idea. It seems so taboo just because mental health in general from a society perspective is still pretty taboo, and we're still learning how to navigate sort of these complex areas. So make sure you stay through to the end because I'll give you some extra tips and bonuses on how to manage your mental health. Talk about it. So it is often known that when we are sick, we take sick days from work, right? So you follow your typical standard procedure in regards to calling your manager, calling a particular line, sending an email, whatever that normal process is for you to call in when you are physically unwell. I want you to know that you can do that very same thing if you are not feeling mentally well. Now, if you're somebody who has ongoing struggles with depression, anxiety, or perhaps you're at a level where you recognize that you are burnt out. And so for full transparency, and so we're on the same page, here's the actual definition of burnout. Burnout is becoming a recognized concern amongst the HR space, amongst the mental health community. It is a legitimate issue that people who have been exposed to an extensive amount of stress over time and unfortunately have not been able to navigate that as a result of work, as a result of family life, and all these things sort of in combination has caused the person to get to this place where they're burnt out. And so I always say that burnout is an indication that it's time to shift gears. And so what we don't want to see is an individual get to that point. And so I bring that up because I want to make sure you understand how important it is to take these days off. And so in the same respect and in the same way that we would call in sick if we were physically unwell is the same thing that I want you to do if you are not feeling good mentally. So the first thing you do when you wake up in the morning, I want you to start taking inventory. In the same, again, you have those cues, those physical cues that tell you you are not well. Maybe it's a stomach ache, maybe it's a headache. And the interesting part of that is also some of those cues can also look like if you are not feeling well mentally that day, right? Is it a headache? Are you having difficulty getting out of bed? Are you noticing a stomach ache? A lot of that can be related to some levels of anxiety. Not always the case, but certainly can be connected to that. So it's going to be really important for us to normalize this idea that if I'm not feeling well mentally, I can also call in sick. And legally, your manager, your team leader, whomever you refer to this person as, does not have the right to question you on that matter. Now, in fact, most companies and most organizations, you can take up to 3 sick day leaves until after that point is when you will be required to furnish some sort of documentation, right? And again, you want to just check in on your individual companies, on their process and policies around that specific number. But generally speaking, most organizations allow you up to 3 sick day leaves consecutively until they wanted you to furnish some sort of documentation explaining why you were out. That is going to lead me to my next step. So if you got to this place where you've gone, you're approaching that 3rd day and you're feeling like maybe you need a 4th day, this is when it's going to be really important to have a mental health provider on hand, or perhaps your primary care physician. Now, some primary care physicians want to manage their patients' mental health and some don't. And realistically, I get it. They are overwhelmed, they are slammed, they see clients with all types of concerns, and sometimes they don't necessarily feel like mental health was in their purview. And so sometimes they will opt out of supporting their client's mental health directly. Now, that doesn't mean that they can't furnish a letter for you, or they can't put something together to submit to HR or submit to your manager. So I want us to get comfortable with asking these questions to our providers. Now, if you have a mental health therapist that's already on hand, then go and just ask that provider directly. like a no-brainer. Like, you just get that done. However, if you don't have a mental health provider already established, then I would want you to get into the habit or get into the practice of asking your primary care provider. Asking your primary care provider if, they're comfortable managing your mental health, if they're comfortable prescribing you medications or whatever have you the scenario is. Get into the comfort of asking this provider. This provider is working with you to support you and your health goals, and your mental health is a part of your physical health. I think that's the biggest thing here. Often we forget, or I think it's more of a societal thing. We tend to treat mental health and physical health separately, right? We tend to treat them in silos. And so as a medical field, as a mental health field, we need to do better in bringing them together. And then once we normalize that, then we can normalize this idea that I can take time off from work if I'm not feeling well physically or mentally. So let's get into the habit of talking to our providers, establishing care early before it's too late. And that can help smooth out this process a lot for you, especially if you're going in around that third, fourth day and you need the documentation stating why you were out of work. Then that should be something that will be the least of your concerns, honestly. It's important for us to remember that if we aren't feeling well mentally, it's hard for us to be productive. It's hard for us to get things done, especially if you have a long history of mental health concerns. You know how hard it is can be to do a simple task such as getting out of the bed. So I say that because our mental health might be struggling, going to work can only exacerbate that for some of us, especially if the work or the job is the main precipitator to that stress or to your mental health issues that are going on. So I want you to get into the mindset that, again, if I am not feeling mentally well, my job is causing me significant stress. What good am I to this job at this point where I just don't have it in me? Like, what good is it for me to go back into this workspace and try to kind of show up, right? So here's what I want you to say in that email that you construct, or that text message that you construct, depending on the level of relationship that you have with your management or your supervisor, whoever you report to. Here's what I want you to say if you find yourself waking up and you just don't have it in you because mentally you are just not all there. I want you to say this: good morning, I am not coming to work today because I don't feel well, period. Just like that. I am not feeling well. Remember before I said you do not have to give details regarding what the health issue is or why you're not feeling well. Just leave it at that, right? And remember, as an employee, you are protected. You have rights. Of course, depending on what state you are in, depending where you work, there are things like unions and things like that that can support you in this and help you feel more empowered. But remember, you do not have to give those details. And if you go beyond those 3 days, again, if you have an established provider, you can furnish the documentation based off having a conversation with that provider and letting them know you just wasn't feeling well. We want to get into this practice where not only for ourselves that we're normalizing this mental health experience, normalizing not feeling well, normalizing this idea that it's okay to not be okay. We're also sort of changing and shifting the culture within the organization one step at a time. And if you are finding that, just those couple days wasn't enough for you, again, it's okay. There are different avenues that you can take. One of those avenues that you can take is Family Medical Leave Act. And again, you want to look and check in with your particular organization and they will sort of communicate to you, or whether it's in the employee handbook or whatever have you, they'll essentially let you know what you can do to qualify for Family Medical Leave Act. And essentially with Family Medical Leave Act, that allows you to take time off from work, a substantial amount of time off of work, and legally they must protect and hold your job. That's up to 12 weeks off. Can you imagine? That's like 3 months, right? 4 months, something like that. So FMLA is a great resource for those of you who are burnt out. For those of you who feel like 2 to 3 days just isn't enough, I'm still ongoingly struggling, and so that is an invaluable resource. There's also short-term disability, which you can look at more long-term, but FMLA guarantees your job when you come back within that 12 weeks. Now you can take up to 12 weeks, right? You can take that full 12 weeks. You can break it down into 2 weeks, 3 weeks, 4 weeks. Like I actually took 2 weeks off, and then I just ended up quitting the job because I realized how toxic the job was for me and my mental health. And so that's a tough decision to make, but I was able to make that decision because I was able to get away from that stressor and gain more clarity, gain more stabilization, so that I can make that really tough decision for myself, and it ultimately ended up being the best decision for myself. And that's the importance of this, right? Remember I said earlier, sometimes our job is the biggest stressor. So if we allow ourselves time away from that stressor, we can get restabilized, we can get more clear on what it is, our focus on what our future is or what our goals are in alignment. But you cannot get there if you are consistently being met with this stressor, right? Or consistently within that environment that causes that great level of stress where your only concern is survival mode. And survival mode just means like just getting by and just getting through. So definitely something that you want to take into consideration with FMLA is that you need to be doing therapy or meeting with some sort of provider ongoingly. Now this will depending on your agency, depending on your state, of course. You know, these state laws, federal laws, they all vary a little bit, but that's why it's so important to check in with your management and leadership. And one of the ways you can check in on that is just look at your employee handbook. That way you don't have to have a conversation with anybody just yet. And so you can kind of understand what the expectation is or what you are entitled to as an employee within that agency. So from there, I would definitely say if this is something that you're considering heavily, I would have a conversation with manager. With your manager, I would bring up, hey, I'm not feeling well. I'm really struggling. And again, you do not have to give full on detail. Let them know I am struggling and I'm considering taking some time off of work. And so legally, they should be referring you to HR. HR will give you the paperwork and documentation that you need. And that documentation will likely have to be completed by a mental health provider or a medical provider. And that's why, again, I say it's so important to have care already established, because this individual is going to be able to advocate for you, and this individual is going to be able to speak to some of the concerns that you've already had established with them, right? Because this is already your established care provider. So that is an excellent way to utilize that to get back on your feet, to just take a time away from sort of everything that's going on, which can be really intense, right? Imagine like your job is like stressing you out. You have a horrible manager. You can't think straight. You can't concentrate. You can't focus. It's hard for you to get things done, but you're pushing yourself and you barely got anything left in the tank. We've all been there before, and we all know how unimpactful really we are to the work, but also for us, right? We're barely getting through. What good are we? We can't show up to other people in our lives, right? We can't be there for our families in the way that we need to do. We are probably short fused, right? Some unnecessary arguments and things like that. We're really irritable. And so think about how that looks like for you, and think about how sustainable that is for you. Probably not too sustainable for you. So hopefully you've enjoyed these tips. Let me know what other questions you have about taking mental health days off of work or even FMLA below in the comments, and let's work together to normalize mental health and mental health struggles, and most importantly that it's okay to not be okay. But what are we going to do to get ourselves back to our baseline, right? Whatever baseline looks for you, let's get the help that you need. And sometimes that means taking some time off of work. All right. I'll see you next time. Take care.